I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and IntellectAbility. For more information, go down into the show notes and click the link where it says Learn More Here.
Welcome to this episode of IDD Health Matters. Our guest today is Dr. Brandi Kelly. Welcome, Brandi.
Thank you.
So, Brandi, I know you do a lot of work in this field. You've been working in the field for a while in Louisiana, right?
Yes.
Tell us about what you do with the state in Louisiana.
So currently, I'm the clinical director for the Developmental Disability Office. I do a number of things in that role. Probably the biggest part of what I do is I supervise what we call our resource center, which is really nowadays a virtual resource center, since we do most stuff out in the field and via telehealth. And it's a group of clinicians across a wide array of disciplines. And these individuals really do a combination of trying to help providers and clinicians in the community feel more comfortable adapting what they do so they can better serve people who have co-occurring needs, either IDD and behavioral health, IDD and complex medical issues, IDD and complex physical and nutritional issues, or, as is the case for some people, a combination of those things.
So a lot of challenging conditions
Absolutely.
and situations that you provide support for people in the state. And being from Louisiana, that speaks a lot to me personally as well too. So that's great to know that you're there doing that. Now, so it's tell me the office name.
So it's OCDD.
OCDD, Office for Citizens
with Developmental Disabilities.
Thank you. Okay, because every state has a different acronym,
Absolutely.
different alphabet soup. But I know that you are doing some things specifically related to helping community-based clinicians feel more comfortable about providing healthcare for people with IDD, which speaks right to my heart, because that's what I really, I'm such an advocate for ensuring that every healthcare provider can provide a basic competent level of healthcare for people with IDD. Tell us what you're doing in the state.
Okay. So, we really do some of that across all of those disciplines. We just do it in different ways. Mm-hmm. A big focus for us lately has really been in the behavioral health arena, simply because of a lot of the access issues there. So we've been working with the Office of Behavioral Health and really with individuals and families who are trying to access services and not really having a lot of success on how do we address that issue. And like many states, we really don't have a full workforce for anybody who has behavioral health issues, whether you have co-occurring other conditions or not. So really trying to make sure that workforce is equipped to serve anyone who walks in the door is a huge part of what we're doing. And so we've really been trying to reach clinicians where they are, kind of in the same way that we talk about supporting people where they are, and helping them to understand how some simple adaptations, right? Things that are not that big of a deal to do. It's not scary. It's not doing totally different therapy. But those adaptations can really allow them to do the exact same thing that they do every single day in their practice and serve people that today they don't feel like they can do. So that's a big focus right now. As I said, we do some work across our other disciplines. It's a tad different, and I'm sure you're more familiar with the medical side of things, right? We do have our nurses who are working often with provider nurses, but the access issue on the behavioral health side is just getting in the door. Whereas on the medical side, it may be more not understanding the complexities of the conditions, but we often get in the door at least. So it really is kind of working different pieces.
There's similarities and differences, and one of the similarities I would say is that what I try to teach medical providers is that I'm not teaching them new ways to treat the conditions they all know how to treat. It's just how they present a little differently, the different approaches that you might see, how so many times a behavior might be the initial sign of that condition, and not necessarily someone coming in and telling you all of their symptoms. So it's just a different approach. What are some of the accommodations that you guys make or teach or help providers learn how to do?
Yeah. So, one thing really focuses on understanding how people communicate differently.
Sure.
Right. And just being aware of that and being prepared. So do you know how the person communicates? How do you adapt what you're doing to that modality? Also, just kind of adapting communication in general. So, change the language, make it simple and easy to understand. Focus on one thing at a time. We also help them understand they may have to sort of conceptualize the pace of therapy differently. Okay. You may not be able to do a 50-minute session.
Right.
Somebody might not be able to sit with you for that long. You may need to do a shorter session. Treatment may take longer, and that's okay. So don't think that you're not making progress just because it's not progress that's as quick. Using a lot of multisensory input. People may need visual cues as well as whatever the verbalizations you're using are, even when they actually use verbal communication as their primary mode of communication. Accommodating activity, role play, play itself, right? Making sure that they understand if the person can comprehend abstract concepts as opposed to maybe having to really stick with really concrete examples and language. And the other thing is really understanding the role of supporters, which I imagine you deal with also on the medical side, which is when someone needs help every day, in addition to whatever work you're doing with the individual, you need to know how much help do they need when they're not in your office, whether it's to do homework from a behavioral health perspective, whether it's reminders when they show early signs that maybe they're getting upset or anxious. What are the coping skills they've learned how to use, but maybe they need some reminders. Sometimes it's helping supporters understand what not to do. We think we're helping. We don't understand what the person's actually learning how to do, so we unintentionally get in the way. So, those are some of the big themes of what we teach them to do. There are many, many, many more detailed adaptations when you're talking about certain types of practices, but those adaptations really apply regardless of the modality of therapy.
And speaking of the adaptations and on all of this, you guys have actually developed a resource that's available on your website, right?
We have a Louisiana guide for clinicians to provide accessible behavioral health treatment. It is actually currently available on the ARC Louisiana's website because their upload process is easier than the state system.
Understood. I worked for the state too in Mississippi.
And they really spearheaded pulling together all of the people to put the guide together so that we were putting together a guide that really was the work across the developmental disability and the behavioral health system with input from clinicians and providers on both sides of our systems and families and individuals who receive services. So we kind of felt like their hosting of it also made it more globally applicable because, as we all know, there are people who have an IDD condition who don't meet eligibility requirements for a state's DV system. Sure. And so this way, anyone can access it, use it. It's not viewed as linked to just our system.
Right. I love that. Love that. So Brandi, how did you get into this field? How did you get into working with people with intellectual and developmental disabilities?
So my youngest sister has a developmental disability. I was 11 when she was born. So we lived accessing services. She has very, very complex medical needs on top of her IDD condition. And while I would not say she has a co-occurring behavioral health condition, she does engage in some behaviors that can be challenging. For her...
Isn't that true for many of us sometimes? Yeah, it doesn't matter whether you have a disability or not. Sometimes we all have behaviors that maybe are a little challenging, right?
Usually when I actually do training, I ask people, how many people have sort of done something today that other people wish you wouldn't have done.
And that's the point, is people with IDD or people like everybody
Absolutely.
else.
Absolutely.
So I'm sorry I interrupted you.
No, and so, but navigating the perceptions of all of her needs, getting what she needed. We've received services as a family, both through the home and community-based system, in a small group home, and at one of the state facilities because of just the complexity of her needs. So really that experience was probably more impactful than I thought. I trained as a psychologist, did not at all think that I would end up spending my career working with people with disabilities, not because I couldn't see the value. I really thought it was going to be overwhelming to live it and to then do it and work. And as luck would have it, our program required us to do a year away from our starting sort of major concentration. And I was at the time kind of working more in the adult arena. And so there was a clinician at my graduate program who did work in the child area and also focused a lot on folks with disabilities. So I thought, well, I'll do that. And I never went back.
You know, you kind of had I usually say people come into this field in two different ways. One, you either have some life experience, a family member, or you just kind of fall into it. I just kind of fell into it. But you kind of had both. You had a life experience, didn't necessarily think you were going to be there, and then you worked in the field, and then you fell into it, and you got stuck, or not say stuck, but you know very quickly if you want to do this for the rest of your life or not. But I'm certain that the experiences that you've had growing up really impact what you do today, and really make it just such a personal connection to the things that you do, because you totally recognize how what you do every day affects people.
Absolutely. I do have times, obviously, like any of us would, where you have to be mindful when you're wearing the clinician hat or the state staff hat. The beauty, I think, of lived experience is it doesn't really leave you, no matter what hat you put on. And what I always hope to do and strive to do is have that lens even when I'm wearing the other hats, never forgetting what that feels like. And my boss, who I know you've also talked to, she laughs at times because sometimes when my sister is in the hospital, I send her frantic texts like, you know what we really need to fix? Because in that moment, it's like we're living it. We're living the things that really maybe don't make sense, that don't work for families, that do not take into account the needs of people with IDD when you're interfacing with these other large systems that are, quite frankly, often used to supporting people who don't have IDD. So absolutely.
Well, that experience, though, is invaluable, and to be able to see it from that perspective, for sure.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of IntellectAbility. State developmental disability agencies, managed care organizations, and providers across the United States use IntellectAbility's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So, there's something I kind of do on the program called 3 in 3. It's kind of 3 things in 3 minutes, but I'm not going to hold you to 3 minutes. I don't know why I still call it that, but anyway, Are there, some tips, some words of wisdom, some advice, some guidance that you want to share with the audience that you think would help improve supports and services or health and wellness? Just really whatever way you want to take this. I'd love to hear your top three.
So probably my number one, and it may actually spill over into 2 and 3 right now at where I am in my career and my life, is wellness. I can't say that word enough. We spend a lot of time talking about people's DD support needs, the help that they need, their medical treatments, their behavioral health needs. All of that is important, but none of that matters if the person doesn't have a good life.
Wow.
And what we often forget is that if we think about when we are not attending to our own wellness, when we aren't doing the things that really make a difference in what is a good day and a not good day, we know that on the days and the weeks and the months we forget that, we don't feel as well. We're sicker. We're more irritable. We lash out even at the people who are around us and care about us. Why we think that would be different? Because you actually have more needs and potentially more things that you're worried about. I don't know. And for me, it wasn't that I didn't know that before COVID. COVID really brought that home for me because we were all experiencing that. And I had a lot of moments where I would think about the folks that we provide services to, and I would just imagine, like, I can figure out how to adapt and I don't need anyone's permission. No one's telling me no. So how do we help people learn about their own well-being, learn how to share with people what really matters to them, and how do we support when they need support in those things, and how do we get out of the way?
Yes. So that really speaks to person-centeredness and the whole concept of person-centered supports and services. And if we only do things that are important for a person, like their health care or eat right or do this or do that, it doesn't really take into account what the person wants, what's important to them and what they want for their own lives. And you have to balance both. And
Absolutely.
Yeah.
And I'm literally doing your podcast with my coffee, so I'll use myself. But we joke, but it's real. Y'all don't talk to me before I've had my coffee in the morning, right? Like don't. But there's reality in that. Those are those little routines and rituals, the way that we start our morning, that no one gets to interrupt or tell us has to be different. The way that maybe when we come home from work, we just don't want to talk to anybody. All of those things, whether it's simple things. Do you want to take a bath or a shower? I mean, that matters. When do you want to do it? How does someone connect with the bigger world? Are we giving them time in nature? Are they moving around and not exercise in the way we think they need to exercise, but in ways that matter to them, and all of that? And what we really are trying to focus on, and what sort of at the end of my sort of state career is really my big passion, is actually that area. I would love it if less people needed people like me, right? Yeah. There aren't enough of us to go around anyway. So how do we help people build up their own wellness and resilience in life? And so wellness is absolutely my top of, if I was going to name 3.
Well, I certainly can agree with that.
Number 2 is not unrelated to wellness, because you kind of can't have wellness without it, but I think it gets overlooked, so I will say it as a separate thing. But relationships, right? So often for so many people with IDD at some point in their life, almost everyone that they interact with is paid to be around them.
Right.
And there's actual therapeutic benefit in having people in your life who are there because they just want to be.
Yeah, you think about it. You ask yourself, would you want all of your friends to be paid people in your life? Of course not.
Right.
Yeah.
And it doesn't mean that you don't value the people in your
Right.
life who are paid. I mean, most of us have, doctors that we prefer to go see because we really feel like we have a connection with them. We might have a favorite hairdresser and we get really bent out of shape when that person's not there. And so it's not that those people aren't important, but they're not the important emotional and social support in your life, right? So I think that's a big thing. And when you see so many behavior challenges, as we've said, linked to what people call attention, it's like we act like attention is like some small afterthought in life when it's really one of the most important things in every one of our days. I mean, imagine if no one cared about whether or not you had someone to interact with in the day, someone to connect with, someone who cared about you. So relationships is really number two. And then my third one is just, and I feel like I could say this as a clinician. And this is not meant to say anything bad about those of us who do clinical work, but our real language is number three, right? Even when we talk about the right things, we often use clinical language to talk about it when we're talking about people with disabilities. And we wouldn't do that for us, right? So when we talk about things that matter and that people want in their life, we talk about preferences and reinforcers, and we use terms like positive behavior support. And look, when someone needs behavioral intervention, we should do it in a positive way. So positive behavior support, ABA, all the other behavioral health therapies, they have a place.
But you're certainly not going to say, I'm going to provide you with some positive behavioral support right now.
Right. And none of us talk about that, right? We don't talk about ourselves that way.
Hey, I see you're feeling down. What would you like to do? Let's do something fun.
And when we can watch that language, that's what will eventually make some of that more accessible to supporters. I think that we sometimes unintentionally make things seem like people need permission to do it because it seems like an intervention from a clinician, when sometimes what we're saying is, just start the day off by asking, Susie how she's doing.
Yeah.
Ask her what she wants to do. If she wants to call her mom a letter. If she's not feeling so hot, learn or ask about what would help. And when we're working in that sphere, that's when all three of those things, I think, sort of work together.
Brandi, I love asking that 3 and 3 question. And as many times as I've done it so far, they're always different. And I love your perspective. I love the way you presented those, and they're wonderful things for us to think about. So relationships, language, and just wellness, right? 3 great things for us to keep in mind. Brandi, thank you so much for talking with me today and sharing your insights and for the incredible work that you do in this field.
Thanks for having me, Craig.